a small inflatable balloon is put inside, it's inflated, and hopefully the artery opens up and the blood flow improves. In the case of a stent, what happens is, after the artery has been opened up with the balloon, to prevent it from collapsing again, you put a wire mesh tube inside, and that kind of holds it up so that it doesn't collapse. This is the common treatments, angioplasties and stents, which are done quite often these days. And again, they work, the people do get some amount of relief, but there are some studies which are showing cause for concern. For example, again, the New England Journal of Medicine stents. In angioplasty, what is done is very straightforward. A small inflatable balloon, there's an artery just clogged up with where we are. So people go for invasive treatments, surgery. So the most two common treatments are angioplasty and solely relying on these drugs from beginning to end. There seem to be a lot of challenges. Because the basic thing is that the doctors are saying, the medical science says that high levels of blood cholesterol cause heart disease. They cause damage to the artery. The artery gets damaged, the body repairs the damage with cholesterol, and then so on and so forth. So we need to reduce the blood cholesterol level. So they're taking it at the first level. High blood cholesterol causes heart disease, so let's lower the blood cholesterol. So that does have effect, it does work, but as I said, these are the problems. Nowadays, of course, there are newer drugs, but a lot of them, there have been, not particularly satisfactory, so we are still stuck. Cardiac reasons do go down, but unfortunately, the number of deaths due to non-cardiac reasons go up. So overall, you see the mortality remains unchanged. So while cholesterol lowering drugs probably are, a good tool which need to be taken, and of course there's a place for them in the therapy, but purely a whole lot of deaths, they stop the progression of the heart disease. And the amount of deaths, these cholesterol lowering drugs do lower. 70% of the patients did very well on this, but 1 out of 4 had a cardiac event within 2.5 years. So that's 25% is a pretty high, risk rate. And then there are many other studies in the 1990s. They have shown that, these drugs do. 3 out of the can. And that also said there was a study done where they gave immense amount of cholesterol lowering drugs to people, to the patients. So they succeeded in lowering the cholesterol level to below 150. So 3 of the patients did well to everybody, but this was a scientifically done controlled test. I can give you the reference if you like, where it showed this kind of a problem. The New England Journal of Medicine in 2004 published a study by others. So one study, for example, showed that after 2 years of treatment with cholesterol lowering drugs, 16% of the patients actually had benefit. But 40% of them showed no difference, and 44% of them actually got worse. So this may not be a universal thing happening, but there are some studies which have been done which show some cause for concern. They are working quite well and fine. Now a lot of people are taking these drugs. A lot of them are intestinal problems, nausea, abdominal pain. These sort of things happen. So you ought to be aware that you can take the cholesterol lowering drugs to reduce your cholesterol, but there is a possibility of all these things happening. But more than that, the bigger question is, how effective are these actual drugs? Liver damage, cataracts, any medical literature you read, there are not enough studies done to see what are the long-term effects of these drugs. But on a short-term basis, everybody knows. So they work, but a couple of points to note. First of all, there's obviously the cost involved, and most probably your doctor will tell you, in most cases, that these have to be taken for a lifetime. So you can't stop it. And second thing is there are complications. There are short-term complications, long-term complications. Long-term complications are not known, maybe. So the first treatment everybody gives is, cholesterol lowering drugs. So this, the reduction of blood flow to the heart because of the arteries constricting, narrowing, the plaque rupturing, etc., etc. So how conventionally, if you go to a regular doctor, what is the conventional method of treatment? So these are all the treatments that are normally prescribed. And I can't talk much about the last two because the heart transplantation and the artificial heart, they are like very extreme cases. Not very often, it happens. So I focus more on the first 4 methods of conventional treatment for heart disease. We have seen basically to prevent that from happening. So it's a defensive healing mechanism. Anyway, so now coming back to it is basically a what shall I say? For example, if you cut yourself, if the blood did not clot, you would have continuous bleeding. So the blood clot is a defense mechanism. What happens is in the body there is a mechanism called platelets. They are responsible for the blood clotting.
Can you explain what is the reason it clogs?
See, an heart disease. It's called a thrombogenic event. So blood clotting happens. The body recognizes as a danger. It needs to clot the blood. So a blood clot forms, and that blood clot actually, if you can see towards the last picture, that's what ends up actually blocking up the artery. This blood clot may also move around the body. It's not just in the heart. So if it goes up and reaches somewhere near your brain and it blocks the blood supply to your brain, you get a stroke or whatever. So these are the broad reasons, technically speaking, why what is the apparent cause of the heart attack. And when this happens, it oozes into the bloodstream. Lining of the plaque ruptures, and all the plaque, which is the fatty dip. So now, as this thing grows, what happens is that the body has built up the plaque. Now here there is a damage. As you can see here, 12.5% of heart attacks. 87.5% of the heart attacks apparently happen for this reason. What happens is this one. This apparently is only for some reason which we'll cover quickly shortly. The inner lining of the blood vessels get damaged, and the body in a repair mechanism tries to put a band-aid, psychological band-aid on it. The band-aid is made up of cholesterol, collagen, some calcium, some other materials, and that's called plaque. Now, if there's continuous injury, the bandages pile up, and that's what causes the clogging. But actually, the actual clogging, like I showed you, so basically what happens is that the plaque, where the rupture region is actually the major, and the third reason this sort of thing happens, it's typically called a coronary heart spasm, and it's very, very severe. It might even damage the lining of the heart, and that causes cholesterol to deposit as a repair, and that narrows the artery further, creates further problems, becomes a cycle. So arteries clogging up, arteries constricting, they are more flexible. They've got smooth muscle cell inside, and therefore when these muscle cells contract, for whatever reason, which will come to a little bit later, the diameter of the artery reduces, and the blood flow gets impacted. So now, very absolutely firm and solid. The heart, they are not like lead pipes. They are not like that take the blood to the heart. Basically, what you have to understand is arteries, coronary arteries, but now why the arteries constrict, we'll go into a little bit later. The arteries constrict. This sort of a problem, according to Dr. Reversed3.avi, is responsible for about 12.5% of all the heart attacks that occur. The second reason for people having heart attack, it might close up, and there you have a problem. So, artery. So, of course, it doesn't happen overnight like that from A to B. It's more of a process. So, you have a full proper artery on top, and then after some time, there's a lot of cholesterol deposits, plaque. It becomes narrower. Finally, it becomes absolutely narrower. One fine day, on the hand side, you can see a regular artery. That's how it's supposed to be. And on the left hand side, you can see a diseased clot and how to reverse heart disease. So on the right, how to prevent the heart gets reduced. So we talk about each of them. The first thing is, of course, the arteries clog up. Here you can see, images taken from Dr. Reversed3.avi's book. Dr. Reversed3.avi has written a book called Reasons Why Blood Flow. So, as we said, the basic thing is that the basic cause is reduction of the blood flow to the heart. So, what causes the blood flow reduction? So, not to put too much of a technical thing into it, there are three basic. So, you get a heart attack, you might even die. So, that is the kind of heart disease that we are talking about here in this particular talk, what we are going to address. Okay. That's got affected, and again you are in trouble. So, might die, that part of the heart muscle may die, you get scar tissue over there. If a large part of the heart has died, then you're into serious trouble. Or if a very important part of the heart, the pacemaker or something, full layman's terms. Okay. So what happens is, as you know, that we all need oxygen, and the heart, any other muscle needs oxygen. So the blood is responsible to carry the oxygen to the heart. So if for some reason the flow of the blood to the heart is reduced, that part of the heart gets less oxygen, and that's what we call it. When there's a shortage of oxygen to the blood muscle, especially when it's under strain or it has to beat harder, faster, you get chest pain, what is called angina. If this happens very frequently or severely, that part of the heart is basically a disease which is caused by a reduction of blood flow to the heart. That is, in ladies start talking about LVBB. So I'm going to clarify what is the kind of heart disease that we are talking about that can be reversed. Her case, I don't know, we may be able to help, we may not be able to help, I'm not sure. But the kind of heart disease I'm talking about is what we cover in layman's language, So what exactly will be, when I'm talking about heart disease, there are so many different kinds of heart diseases. So, there's a wide variety of audience which like to cover, right? 45 minutes and then have the questions. Patients about maybe I better come this side because the laptop is there. Okay, so we start off, this is a short right, so I think I came personality. Okay, good. Fair enough. Okay, so
the type of personality.
Mother has hypertension.
And she's
okay. Hypertension.
and mother has hypertension.
So it's a very unique situation. So you need to work with a doctor for that. Anybody else? Heart problems that people have. Because more for the conventional. Yeah, but this talk doesn't really address your problem directly.